Audience, I'm going to give you the nursing handover. This is bed 3, a 60-year-old female with a fractured hip for surgery tomorrow. Okay, on to the next patient. Audience, I'd now like to give you the patient's perspective. Bed 3 is Mabel, a mother and a grandmother from a community quite far from the hospital. She normally lives alone and manages independently. This is her first time in hospital and she is extremely nervous. What worries her more is she knows none of the nurses' names, they've given her no information, and she'd really like to ask some questions, but she doesn't want to appear bothersome. On a busy night shift, one of the nurses comes in and gives Mabel a pot of tablets, urging her to take them with no explanation of what they are. Many thoughts go through her mind. These don't look like my tablets. Are these new medications? But the prevailing thought is she must be a good patient, so she takes the tablets without question. Unfortunately, in her haste, the nurse has given Mabel the wrong medications, a daily occurrence in hospitals. Medication errors cause adverse events and even patient death. Yet, when patients like Mabel speak up, they can stop these errors before they occur. Did you know researchers have found that adverse events are halved when patients participate in their care? There are many ways patients can participate, by asking questions, sharing information, or even undertaking some self-care activities. Yet, patient safety is compromised when patients do not take part. My PhD has improved our understanding of patient participation in nursing care. My findings show that patients are really motivated to take part in their care. They especially want to share information and ensure their own safety. Patients state they constantly keep an eye on everything going on around them, looking out for errors. However, they state the nurse's manner, especially if it's negative, strongly influences their confidence to take part. For nurses, they too value the role patients could have, but they state it's a real balancing act between fully engaging the patient while maintaining hospital rules and keeping the patient safe. Importantly, they recognise it is their role to encourage patients to take part. Unfortunately, my observations of practice show that nurses largely control care, providing little role for patients to be involved. So my research has really shown we still have a way to go. I intend to now use these findings to develop future strategies to enhance patient participation in nursing care, which may in turn improve patient safety. For instance, approaches where patients are encouraged to monitor their medications could improve their partnership with nurses. Thank you.